Good afternoon, everyone. This is Wednesday, the 2nd of February, National Heart Health Month, and we are here on OurTV.network with our health, wellness, and lifestyle program. And I am excited. I'm Linda Dorman, your host, and my amazing co-host is the incomparable Dr. Donna Christensen, former Congresswoman from the United States Virgin Islands. And she is with us not only as co-host, but today we're going to talk about a subject that's near and dear to her heart as well as mine, having served for 11 years as a member of the legislative office for Congressman Frank Horton from upstate New York, as the 29th district. And of course, so I saw in the halls of Congress a lot of legislative activity and understood it as a young person starting my career. And I'm excited to have this conversation with Dr. Christensen because we talk about a lot of different specific health program topics: heart disease, kidney disease last week, mental health, and bone marrow, sickle cell. But we need to elevate the conversation today to talk about policy and how we go about developing those impactful laws like the American Affordable Act, and all the healthcare acts that are out there that become law. And we want to give a little bit of a master class and step back, and we cannot do it any better with Dr. Christensen, who is a formidable force and has been a remarkable force in our United States Congress and still in retirement. And of course, you know her as also a 20 plus year family physician and a member of a number of brain trusts with the Congressional Black Caucus on health and wellness. And just I could spend the entire hour of our program going over her resume, but every week we come
necessary. I think we'll get right into the matter.
But let's get right into the matter. So Dr. Christensen and I talked about, we wonder, based on the level or lack thereof of civic involvement in our voting process and understanding and pushing and advocating for the kinds of legislation that are going to help us from a healthcare perspective. Do people really understand the process first before we start diving into any one particular piece of legislation? So Dr. Christensen, what would you say to our audience and viewers in our Roku TV family network and online with WSXT radio? What would you say to those individuals about this process called our legislative process?
Well, I would say that starting out that it takes a bit longer than I think most people realize, and it does take a lot more behind the scenes activities also to get things done. I could go through one particular, just the history of maybe a bill to show you how long it takes. Because in 2003, the Congressional Black Caucus, Hispanic Caucus, Asian Pacific Islander Caucus, which is called the Tri-Caucus, introduced the Health Equity and Accountability Act. Now, before we could even get to that point, we developed principles that needed to be put into legislation to assure the health equity for people of color and people who are poor and people who live in our rural areas. So we started with the principles and we took them to our caucus and had our caucus agree to those principles. So we kind of locked in the caucus to a set of ideals that we wanted to put into legislation. Now, remember, for most of my tenure in Congress, we were not in the majority. We were in the minority. So in 2003, Elijah Cummings was the first person to introduce the bill, and it rotates through the caucuses. So he was the caucus chair for the CBC at the time, so he introduced it and then he went to Hispanic and Asian and back again. It took us until we were in the 110th Congress when we first were in the majority to even get a hearing. You can't get a bill through without going through what we call regular order. Regular order means it's assigned to a committee, and that committee should have a hearing on that legislation. So it took us until 7 to 8 years to get us to the point where we actually had a hearing. Now, the bill
Wait a minute.
Was
Can I just make sure I'm clear about that? It took us 7 to 8 years before we could even get a hearing on the potential legislation. Okay.
Yeah, about
Because we're going
7
to come
years.
back to the why is that.
Well, who determines what bills are in the committee is who's the chair, and who's the chair is determined by which party is in the majority at the time. And we were out of the majority for for all of those years until the year that we got the hearing, and I may be off by a year or so.
Mm-hmm.
Yeah, so if the chairman of the committee does not see it fit to have a hearing on the bill just sits there, no matter how much you advocate for it.
Wow.
So, and the bill was introduced in both the House and Senate in the initial stages. We lost the Senate through a few of the subsequent years, but in the first two iterations, we were able to have it House and Senate. And that bill not only came from the Tri-Caucus, but there were a lot of meetings with a lot of national organizations to create this very comprehensive bill that would address the disparities in healthcare. So here comes healthcare reform.
Yes.
Another thing that people may not understand is that you may get the bill passed, incorporated into another bill, so you never see the Healthcare Equity and Accountability Act passed, but maybe a portion of that may be passed in another bill. So it would look like nothing has ever happened with it.
And
But
would that
that's,
be another bill that is relevant to the subject or,
yeah.
okay, so
We
it's,
incorporate other bills. For example, we have incorporated in the Health Equity and Accountability Act bills on sickle cell, bills that have to do with diabetes, um, bills that have to do with technology. Some of those may be passed in other iterations. So when healthcare reform started, we decided to use our bill as a template for what we wanted to see in the Affordable Care Act, which in the House was called the Patient Protection and Affordable Care Act. And we insisted that equity had to be a part of it, that a core part, and that there were provisions that we fought for inclusion that included that we had to have data by all kinds, by race, ethnicity, socioeconomic status, as much as we could get. We never really got all of that. They're still fighting for more data. That the territories and the American Indian tribes needed to be treated equitably. That social determinants of health had to be included in the provisions. There were many. So we were able to incorporate some of our bill into the Affordable Care Act. Not as much as we want, because this is where we are today. You can pass something in the House and it never gets passed because the Senate doesn't pass it. Now, we were able to get the Affordable Care Act, but it was much change from what we had in the House. So it's a long process. And I can remember times with other legislation that when it gets into sometimes you pass it in the House and the Senate passes a different version, then it has to go to conference. And the conference committee has to find something that combines as much of each bill as possible to come out with a final product. And I can remember nights going to these little rooms where the staff was working in the conferences to try to, advocate for whatever it was we want. This may not have happened with this particular bill, because that bill never really passed in its entirety in the House and Senate up to today.
Are those
But we would get
conferences?
pieces of it.
You get pieces of it. So the process, this is enlightening, at least for me, and I'm well
It's just
versed.
an example of a really tough.
Yes, it's a tough stream. It's very tough to enact laws based on the activities of the House and obviously the Senate, and having congruency and agreement, which is why our party
Having the
system,
leadership in agreement with what you're
absolutely,
trying to propose, otherwise it never gets heard. And
yes,
we were able to pass a lot of things in President Obama's first term when we were in the majority, but they never got heard. We passed energy legislation in addition to the Affordable Care Act and other pieces that never really made it to his desk for signature. So you
Well,
just keep working. You have to keep working at it. And
yes.
as the chair of the Health Brain Trust, when we met a snag somewhere along the way in anything, we would reach out to our partner organizations to start their advocacy and to to push for whatever it is we needed to overcome. So
Yeah,
it
so it
you
brings to
can't
me.
just go to vote on election day and then sit back and wait for things to happen. You have to stay active, and if it's an issue that's important to you, you really have to push on the outside and have your champions on the inside also working.
You said something really important. So many things that you said were important as we understand this process, because we have to push. The we that you're talking about is JQ voting person out there. It's the individual who believes that their vote doesn't matter, but in fact, it actually does, because we're sending members of House of Representatives, our Senate. We're sending them to those halls of Congress and the Senate to do just what you've described, to determine what is the best course of action legislatively for, let's say, in this case, healthcare and all things relating to healthcare, and then advocating, pushing it all the way through. So we have the Senate, we have the House version of the bill, and let's say that actually gets passed. You have a party system there that compresses on each other and comes up with an agreement. Let's say they do agree, and it moves then to the Senate, where it has to move in order to be finally agreed on before it can actually go into the White House. Executive branch of the government is coming from the legislative branch in order to become signed into law. And so, if not at the Senate, where we left off in the process, that it would go into conference to look at both bills to see where there is the
That
House
means the
version
Senate has to pass it,
and
has
the,
to pass something for it to
yes,
even get to conference. So if they don't pass it at all, you never
all the,
end up in conference and the bill is just stuck. Which is
so
where we are with the voting rights and the Build Back Better, and because the House has passed it all.
but the Senate has not passed it in order for it to actually go into conference if it's a different version.
Right.
If it's a different
It never
version,
makes it to conference if the House does, if the Senate doesn't, Senate and House don't have bills that have actually passed the particular bodies.
they're not in parallel in the language. So then let's say it successfully goes out of conference. We now have a single bipartisan version of the bill that all can agree on. What happens after that?
This implementation. We can talk about there's a bill that called a surprise, what is it, the Surprise Bill Act.
The Surprise Bill Act.
Yeah,
That's a little strange.
I sit on a board that's called Consumer Quality Care, and we've been noticing that people will go into an emergency room, um, which is something you can't help, and you may, the doctor that takes care of you or the hospital may not be in your network, your insurance network.
Mhm.
And so you leave there and you end up with a huge bill. There are other times where some insurances don't cover babies as they're born. And so if you have a baby that has to go into a neonatal intensive care, you may end up with a surprise bill that you really didn't expect because both parents are really insured. So we've been advocating on that. And so the bill was passed in 2021,
Mhm.
but it is just in January of 22 is when it's finally being implemented. So there's an implementation process that the public often has a chance to comment
Hmm.
on the implementation of it. So it's implemented as of January uh, of this year.
Mhm.
So it's in effect, even though it was passed about mid 2021. And what it does is it allows for individuals who end up in a situation where they're seeing an out of network provider in an out of network facility to not to be billed within their insurance carrier and not be having a surprise bill that
You know,
they have to pay. out
So
of pocket.
kudos to the Congress for getting kudos period that it was enacted and brought into our laws,
Mhm.
and as a very important piece of legislation, because I don't know if anyone that I know of that has ever walked into an emergency room or a doctor's office or had surgeries and you are under, and the next thing you know you get a massive bill for something that from some extra part. I once upon a time had a broken ankle and I had a surprise bill. So we're talking an invoice, a hospital bill. So we're not talking dollar bills. We're talking about hospital bills, invoices that you were not really clear that you were going to be responsible for based on services, and then where that service was or was not covered by insurance of any kind, government support or private insurance. This bill was for a 3D X-ray of my ankle break
Oh
at
my goodness.
$1,500. And I thought, well, that's really kind of cool that I had a 3D X-ray, but $1,500 for that X-ray separately billed because it was from the radiologist. You know, it was a pretty bad ankle break. Yes. I'm grateful for the orthopedic surgeon that performed it, but he called for that level of X-ray, and I was responsible for the full cost because it was not a covered.
Right.
It was a specialty X-ray. I didn't have any say in that process at all, except for here is the bill coming to my mailbox.
There's
And
some work around transparency of cost as well. I believe it's a part of how it's been implemented as well, because patients don't know the cost of. It's hard to find out the cost of even a doctor's visit sometimes. But so there's some legislation around increasing the transparency of cost, both in the No Surprises Act law, and also there's some in the what they're trying to do to upgrade the HIPAA law as well.
yes, I think inside that HIPAA law, there are a number of upgrades. But can I, on that note, can I ask you a little bit, kind of a way step back into your own practice as a physician? And the responsibility of the patient is there as well to ask. Did you typically, or to your knowledge, your team that supported your medical office or the work that you did in hospitals, do you know if they typically, as the health consumer would say, excuse me, can you tell me how much that service will cost? I think there's a level of intimidation that we have to help our audience understand that you have a right to know and can ask, and that it is okay. Doesn't mean that you're going to be denied services. It means that you're going to be prepared for not only the service, but what it will cost as well, if that is necessary.
That conversation would come up sometimes if the person came but was felt that they might have not been able to make the cost of the visit. Yeah, but it didn't come. It's not something that now you're talking 20 odd years ago, right?
Yes.
So no, that was really not as much an issue as it is today.
Well, it's important because when we think about HIPAA, and I know that people have heard it in its acronym, but we want to share the actual name, the Health Information Portability and Accountability Act.
Mm-hmm.
So that's Health Insurance Portability and Accountability Act. Can you tell us what the base law is and why this?
It's something that protects the privacy of the patient's information. Uh, all of your health records are confidential, and it controls who can see it, and under what conditions another provider can have access to your health records. But it's a protection for the patient or the consumer of healthcare to protect their privacy.
And why is that important? I mean, I think that some people will say, well, it may not be important. We have apps out here that have my information. I'm asked at work a certain number of questions that may or may not be applicable. We certainly now have a real survey that all of us have. If we're entering into certain buildings, certain events, or people coming into your home, you're asking questions like, have you been exposed to anyone with COVID? Have you had COVID in the last 14 days? When's your last COVID test? Are you vaccinated? With all of those kinds of questions, be considered part of the privacy, and we shouldn't be asking, and we shouldn't be subjected to it?
There are some allowances for information to be shared if it's a major public health issue or a major legal issue.
Mm.
Under certain, it's very controlled, but there's certain circumstances where information can be shared if it's a critical issue to the public health. So the law, if there is a law or a regulation in a particular city that says only vaccinated people can go into a restaurant, the restaurant has the right to ask. I mean, it's up to the person. The, the information mostly is under the control of the person to whom that information belongs. But in a situation like that, they're allowed to ask, and the person can answer or not answer.
And,
But then they can't come in.
and that information has its own acronym called Personal Health Information, PHI.
Yes.
So when you go into your doctor's office, it's probably one or two of the last forms you're going to fill out that indicates that if you have to send your children's records somewhere, let's say to a school, then you have to give that physician's office permission to allow those records to be shared. That's what we're talking about as an example.
Yes, and there are times when it has the HIPAA law has interfered with coordination of care on the other side.
Wow.
So I know in working in public health clinics, trying to get psychiatric information, for example, which is extremely protected. That has the highest level of protection. Any mental health issue of any sort. You could not get, it could not be shared, or the entity that had control over that would not share that information. So there's going to be a little bit of, in the way that it's being looked at, having some reforms made in this year, to ensure that the care of the individual is comprehensive and coordinated. There will be some ways that that information can be shared.
So we want to make a distinction. I think it's important because because HIPAA, because every employer, you're going to sign off on some level of a document. This is very prevalent across many of sectors, health, your employers, even some, ecumenical, religious centers that have health ministries as an example. There's something to understand if they're health or if they're a HIPAA covered entity. So hospitals, as an example, would be considered a HIPAA covered entity. How can we help?
Departments of health,
Mm-hmm.
federally qualified health centers,
Mm-hmm.
and there's regular training that goes on to make sure that every employee is up to date on what the HIPAA requirements are, or has forgotten, because it's not something that you keep it, all of the intimate details at the top of mind. So there's often training. And one of the issues that was discussed in something I was reading about the new proposed slight easements and changes, is the amount of training that's going to have to go on. First, the actual how this is going to be implemented, and then the training, because now it will take a new set of training modules to adjust to any changes that are made in the HIPAA law.
And that's training for the health provider, the healthcare provider, on
well, the
or
people
the individual. No?
I think it goes beyond that, because it's a healthcare provider, of course, but if you walk into a doctor's office, the person who's taking your initial information also has to be HIPAA trained.
Oh, okay. I see. So the front office. So anyone within the continuum of care line. So from your first point of contact to your service provider to even your billing, which kind of takes the entire cycle, the life cycle, and all the individuals around that life cycle will need to be trained in these new HIPAAs, because the legislation not only dictates and mandates, but the liability for slippage in sharing critical information, because it can be very devastating to families in a number of different ways. But then it's also very challenging. You know, we're in an opiate crisis right now. So while I might be a family member taking care of someone with a dependency on a drug of, in this case, it could be alcohol, it could be any kind of drug that puts them in a place where they can't necessarily speak for themselves, and I don't have power of attorney, and I need that information. I'm stopped at the door because of HIPAA. That's correct. Is that, am I saying that correctly? Is that my understanding?
If you're considered the next of kin and you're bringing someone in who cannot speak for themselves, and it's a serious issue, I think it's covered. The definition that I'm seeing, that this is a word change, to expand the ability of a covered entity to disclose the patient health information to avert a threat to health or safety when harm is seriously and reasonably foreseeable. This is what is changed. The thought is to change it to, currently it is when harm is serious and imminent. And so it's kind of eased a bit to where it's seriously and reasonably foreseeable.
And that
Again,
makes
it's the implementation and the training is going to be, very important.
really important. So then, that dovetails into every single other health legislation there is when we
Yeah.
start talking about PHI, personal health information, and all of the umbrella regulations. Are some of these actual laws, or are they state level mandates that take the recommendation from the law? What's the
No,
relationship?
HIPAA is national. This is federal. This is federal. There's no departure from something like HIPAA. No.
Well, we've got a lot to cover, and that was just one piece of legislation. We're going to take a station break, but you're watching our TV network. We are also on Amazon Fire TV, Apple TV, Android TV, Roku TV, Tempo TV, and at our own our TV.network, our own platform. And we welcome you to come and view us every Wednesday with the health, wellness, and lifestyle program with Linda Dorman and Dr. Donna Christensen. We will be right back, and we'll talk more about legislation that impacts us from a healthcare perspective. We'll be right back. welcome back to the program, Health, Wellness, and Lifestyle on this wonderful Wednesday, February the 2nd. I'm here with Dr. Donna Christensen. I'm Linda Dorman, your host, and we are talking about the foundation of everything that we do, and that is in terms of creating a quality life, and that is the legislative impacts to our lives, the laws of this country that impact our health care at every conceivable level, and understanding how laws are made, the complicated, very compounding process that you and I, as voters, must appreciate as we send our congressmen and women and our other legislators at the state into those decision-making seats. And so Dr. Christensen, former congresswoman from the U.S. Virgin Islands, knows that all too well, and also a practicing family physician of 20 years in the U.S. Virgin Islands. So we're back for the second part of our discussion, and we just did a master class, I think, on HIPAA.
if I could just say, the impacting your legislation starts at the election, at the ballot box, by electing individuals who you know share your interests and your concerns, and who will advocate for you. You got to vote your interest, and this upcoming election is going to be extremely important.
It's going to be vital, and we appreciate that we've had so many individuals come to learn, particularly our young people, the process, and really become advocates for change. And that's what we all have to do. We have to do our research, and we have to vote, as you said, our interests. We're not going to get everything in a single person, but what is your priority? What's the thing that's going to impact you and your family and your community the most, that you feel most compelled about, that you believe that in your voting rights, and you have them, to make a decision? And by the way, that vote does count. So it is important to get out there and vote, because it tremendously matters, as you're hearing on how this process comes back to the individual. So Dr. Christensen, in December, we had a wonderful program, and we talked about things like sickle cell, and we talked about a number of different health issues, of which there is a legislative companion that helps to get more from our healthcare system, things that compel our healthcare system to do. I know that one piece of legislation, and the work that you're doing with those who are currently in the Senate, Congressman, Senator Booker is one. Congressman Danny Davis out of Chicago is another. Can you talk to us a little bit about this particular bill or set of bills, the sickle cell disease comprehensive act?
It's a rare piece of bipartisan legislation. It's Senator Booker and Senator Tim Scott in the Senate, and Danny Davis, Congressman Danny Davis, who I used to work with on sickle cell issues, and Congressman Michael Burgess, who I also worked with, who's on the Republican side, have both introduced in the House and Senate the comprehensive legislation around sickle cell treatment. I think it's the Comprehensive Sickle Cell Treatment Act. Is that the title of it?
If I'm not mistaken, I have the Sickle Cell Disease
Comprehensive Care
Act. Yes.
And what it does, it's sort of a pilot project to using which will be put under Medicaid, to ensure that sickle cell patients and their caregivers get all of not only the medical support, but the personal supports that are needed for such a chronic, potentially debilitating disease, both on the prevention side, on the treatment side, and all of the other social and required supports to make sure that the care is comprehensive. And since it's being introduced sort of as a pilot project, this will demonstrate how this can be done, and then can be expanded beyond that. But I know Senator Booker for sure, because I know him, and Congressman Davis have worked on sickle cell issues for years, and the patients are still not getting the kind of comprehensive care that is required for a disease like this. And so this will help to address that.
And when we think about it, it takes my breath away, and it makes me sad on some levels that we are still in need of legislation that actually dictates comprehensive care for those who are suffering from, by and large, a genetic based disease, sickle cell. And while it's remarkably prevalent in the communities of color, African American community, it strikes me that it's been so underserved because of the health inequities and health disparities in believing that African Americans um, um, need the types of treatments that are required when we have something as sickle cell, which is extremely painful when it's in full bloom in your body. It can be excruciatingly painful.
Yeah.
And so that comprehensive care and the requirement um, strikes me as not only necessary, but extremely vital to a number of other tag teams like maternal health, as an example, women's reproductive rights in health, as an example. When we think about health inequities and health disparities, why do you think that we need these types? I mean, what is happening out in our healthcare system that we're not getting the type of frontline believability or the credibility for patients coming in and saying these are the types of services that I need, or being diagnosed and still not treated for a variety of reasons? That's a big
That could be
question.
a whole other story. But why are some people not getting the treatments that are required? That are required?
Right.
It's
That
because of the long time racism that's built into the system, and discrimination, and built into people's psyches as well, so that
Mhm.
um, in the case of many providers, they're not thinking about discriminating, but they make judgments around people who are black, people who are poor, people who are um, maybe speak a different language, that gets in the way of them providing the optimal care that they would provide to a white, well-educated, um, insured individual, for example. So it's that. Um, there are some uh, other systems that are in place in insurance companies' algorithms and hospital algorithms that also interfere with you're getting the appropriate amount of care, because, and those are changing because people realize that they exist finally, that undervalue a person's life based on who they are. And so if your life is not valued at a particular level, the care is not necessarily provided. And we find that we didn't talk about transplantation as much last week when we met, but it causes people of color to be at the bottom of the line, has caused people of color to be at the bottom of the line for transplantation. But and there was some other thing that I was going to mention around. But in addition to that, there are the social determinants of health that people do not take into account and are not being addressed. And I my position is, as long as the system continues to operate the same way, and we saw the IOM report back in 2001,
Mhm.
and there are reports currently that demonstrate the same um, bias in treatment of people, whether they're black, whether they're white, whether they're poor or not. There's also access problems. Um, and you see hospitals closing in neighborhoods that need them the most.
Yes.
And then the big hospitals consolidating and not really fulfilling their total obligation to a lot of the communities that need the care. So there are so many reasons, but it's based in um, the old system of racism and discrimination that has permeated every other factor of people's lives, and it affects African Americans, American Indians, and other people of color. But African Americans and American Indians and Native Hawaiian, Native Alaskans.
Yes, and I think while Dr. Christensen's technology comes back onto us, I think it's important for our audience to understand a terminology that she's using, and that's social determinants of health. So, because this is something to think about when we look at communities and we have our tax dollars go directly into those communities to strengthen the social services, it matters because it will, all of that is interconnected to the communities that are affluent, the communities that are middle class, where there are more resources versus those communities that are underserved. We're all interconnected. So it's important to understand social determinants of health are the economic and social conditions that influence individual and group differences in health status. So they are the health promoting factors found in one's living and working conditions. So these are some of the examples: distribution of income, wealth, influence, power, rather than individual risks, such as behavioral risk and factors, and even genetics that influence the risk for a disease or vulnerable to disease or injury. So this is what we call the social determinants of health. It impacts both individuals as well as communities. And we have to understand that it's based on where we have food deserts, as an example, where we have lack and access to healthcare. Dr. Christensen, before her technical challenges came into play, where we have community hospitals and clinics that are folding because they can no longer afford to operate in those direct communities. But then it takes a lot of energy and effort and time for individuals who are needing to access healthcare to drive or identify the closest healthcare centers for their treatments. These are impacts to that. If there is a community that is riddled with violence and lack of other types of social services that are wraparound, what we call wraparound services, not just health, but education, job opportunities, access to healthcare, even support for things like behavior and mental health. If those resources are underserved in those communities, you are going to be subjected to the social determinants of the type of healthcare and the amount of healthcare, and therefore how you even fund healthcare in those communities. We are here on the Health, Wellness, and Lifestyle program with Dr. Donna Christensen. We hope to get her back on. You know, live TV can be a little tricky sometimes on different platforms, and we just welcome all of our viewers and our listeners to talk about this incredible subject called the legislative impact of healthcare in our country. We had also talked about the fact that it's important to be a very active voter because these things matter. We learned on the program that from the time we send our congressmen, our senators, our local state representatives into the halls of their legislative bodies, they're advocating an issue, a platform, an interest on your behalf. So it's critical that you think through your responsibility in becoming a viable advocate, a voter, someone who understands and knows that, in fact, while the rhetoric is out there, in fact, your vote does count because these votes translates into their vote, into their work. And the there that I'm talking about, the they that I'm talking about are your congressmen, your congresswomen, your senators, your state representatives, those who are speaking on your behalf that are enacting laws that you and I will become subject to. And so we don't want to get on the other side of an issue. We want to be in the trenches with them, but we have to have those who have similar issues or similar concerns to ourselves. And we know that we're in a very partisan society, but this is where the strength of educating ourselves around the various health topics. This program addresses health, wellness, and lifestyle issues as it relates to health on a weekly basis every Wednesday. And so we invite our listeners and our viewers to actually let us know what you might want us to talk about. We have a tremendous resource of individuals who are ready in the wings to come and talk to our audience about what matters to them. And that makes us do our job very, very well. Today, because Dr. Donna Christensen is one of the most amazing women that I have met, from the U.S. Virgin Islands, has spent a tremendous amount of her career as a family physician, working both in private practice as well as in a hospital setting in the U.S. Virgin Islands, and being very active and bringing all of that wealth and knowledge into the halls of Congress and working with the likes of uh, uh, Tim Scott, who is a Republican senator, Cory Booker, who is a Democratic senator, on key legislations such as sickle cell disease, and making sure that we have the type of platforms and the type of issues that literally will carry forward because it matters so much. The other thing that is most important as a voter is making sure that you have passed that information on to the next generation. That next generation has to be well versed, because the issues coming forward are going to be that much more complicated, that much more challenging, because now we have technology that is so threaded into our healthcare system. The electronic records information system is a super database that maintains and holds all of your records. Who owns those records? How are they transported from one place to the next? From your hospital where you walk in, and your clinics where you walk in and you receive your treatment, and all that information goes into the electronic records, to the people who needed to support you as you go forward. Dr. Christensen, welcome back. I'm just having a
Yes,
great.
I'm on my phone right now.
Okay, because technology,
Yes.
you know what, you landed at the right time. I was just sharing with our wonderful audience, and we also have our audience from WSTX AM radio
WSX.
970, and our SWTX Bloomberg, in addition to our TV platforms. I was just sharing with the audience, and I could hear them saying back to me, yes, that's information that I need about the electronic records and the type of legislation, and the importance of why understanding their vote matters as we think about these very nuances and niches within our healthcare system that ultimately impact on all of us. You know,
Yes, and you know, in addition to legislation, though, I think if individuals out there have a particular issue they're interested in, I think it would really be great for them to join an organization that deals with that issue, because
mhm.
they will be kept abreast of what's happening legislatively, and what's in the the federal register that they can comment on, for example. Um, so it's a really good way to stay engaged on issues that you're concerned about.
I thought it was something very important that you said that I was not aware of, but I'm going to do my research on how to become that much more active in that. And that is that we as citizens are allowed or have some access to commenting on bills that pass in the Senate that go into conference, because the corresponding bill that was raised up to the Senate is not quite from the Congress, is not quite, does not mirror each other. So we have a bill that passes in the Senate, we have a bill that passes in the House. They're not quite twins. They go into conference. And at some point, I have an opportunity to have a comment, to provide some feedback. How do I do that? Is there a place that I can go? Or do I just know to call my senators? And this is where they say, write your senators about that bill because it's in conference.
Right. Or and sometimes the agencies, for example, one of my organizations just commented on some policies that the Centers for Medicare and Medicaid Services is considering. But that's why I suggested being in touch with an organization, even just going online and checking that. If you, for example, if sickle cell disease is an issue for you, go online, check out the organizations that are for whom that is an issue, and you will see on their website what's going on legislatively or policy wise, that you might be able to comment on. For example, one of the bills that I noticed that, as I was looking at health, it's called the Prevent Pandemics Act. It's Prepare for and Respond to Existing Viruses, Emerging New Threats, and Pandemics Act. Now, I just happened upon it, and there's comment up until February 4th. If you go to Help Pandemic Bill at helpsenate.gov. So there's opportunities, but I just happened on that bill. And it's really a shame that it's coming up now, because it's to strengthen the nation's public health and medical preparedness and response systems. But we passed provisions in the Affordable Care Act that would have strengthened our public health infrastructure, created new public health providers and researchers and different practitioners back in 2010 with the
Wow.
Affordable Care Act. But here's where another problem comes in: if it's not funded. So
Oh, wait a minute. Let's do a little parking lot on that one. So if in fact it passes and it goes into implementation, now we have to have the governmental funding to actually carry that implementation forward.
yes, and you will remember probably that shortly after that, the majority changed back in the Congress, and so there were about at least 60 attempts to actually repeal the entire act. But
Yes.
in between that time, because that could never be accomplished, funding was taken from different areas. One of the things that we created in the Affordable Care Act, we expanded on the offices of minority health in different agencies, and that funding was threatened. And that was one of the times we called out to our national partners to jump in once we heard that was happening, and we were able to save that funding. But yeah, so
It's very
it's a bone of contention for me, because we would have been in so much better shape when COVID came if that had been funded. Another one that really never got funded was a provision to train providers on the use of opioids, and to kind of, because it was in the relatively early stages of the opioid pandemic. That was not funded really either, and so here we are. We're still dealing with an opioid issue.
what our audience really needs to understand about these things, about the funding. Talk about the funding that either we're going to spend your tax dollars on the front end and make those tax dollars efficient in their spending for programs, for training, for educational campaigns, for workforce development in these new areas, as an example. But now we have to go into lawsuits and litigation. We have to go into social services that are still going to get funding splintered from different places. And then we have to go into all the treatment for those who are suffering or have been impacted by this opiate crisis, as an example. And that's just one issue that could have been mitigated, but for the eyes on that legislation, eyes on the funding to support that legislation. And that's where we come in as taxpayers and as voters. It's part of our civic duty and responsibility to keep our eye on the ball, as well as the elected officials. So I think I share that bone of contention with you. Because I know that there are many subjects that follow that same pathology of funding needed for bills that have passed and are very critical, or those parts of a bill, as an example, the training in the Affordable Care Act and the pandemic infrastructure support in the Affordable Care Act, that are taken out as part of the negotiation for getting what parts we can get passed.
Right. And a lot of times provisions like that are authorized So you authorize the funding, but then that funding has to be appropriated. And so a lot of the fight also is around the budget. That's something that's passed around March. So your budget, you fight during the budget period to get enough funding in the budget to cover some of the things that you want to have covered. And then you go through the appropriations process to try to put the funding in the programs that you've authorized.
Well,
So
we
just stay in touch with your people who are working on your issues.
Well, Dr. Christensen, I just actually just want to say how much I respect and applaud you and adore you all at the same time. You're wearing your heart, and I appreciate that. So we can have a 2, 3, 4, 5, 6 part conversations around this, but we wanted to start out our Heart Health Month, giving a backdrop, a foundational, a laying of the land for everyone to understand about how healthcare is impacted through the political process. Become active, become engaged, become caring of your rights as a voter, and get involved in that process. So this is the health, wellness, and lifestyle programming every Wednesday. We welcome you back. We welcome your commentary. We welcome the topics that are concerning to you. We want to hear from you. We thank you very much for joining us, Dr. Christensen. We appreciate you always, and I look forward to seeing you next Wednesday. So you are watching this program on our TV. We are also on Amazon TV, Fire TV. Just got the Fire Stick myself, Apple TV, Android TV, Roku TV, Tempo Networks, and at www.ourtv.network. And we are also broadcast radio, WXSTXAM 970 and WSTX Bloomberg. Have a great afternoon, everyone, and we'll see you next Wednesday, Health, Wellness, and Lifestyle.